We want to make sure that we have our quorum here. Do we have 7 on here, Sean?
Right now, I think I'm counting 6. So I know Gail is reaching out to a couple of the other members on her phone. So let's give it just a few minutes.
Okay.
In the interest of time, I can go ahead and discuss, my part of the report, because there's nothing to vote on for my part of the report as far as the executive director comments, and we can knock that out. First, let me just say we've been focused almost completely on COVID-19 since March, and it's been a challenge. Disease investigation and isolation and quarantine and enforcement of public health laws and public health messaging. These are all things that we've done for years. It's just not been at this magnitude and for this length of time. So it's been trying. It's been challenging on a personnel perspective to have that much work, but it's also been challenging because most of what we've done historically has been pretty well universally accepted from the public's perspective. It's everyone pretty much agrees we don't need to put human waste into the waterways, and that we need to keep a restaurant closed if they have a insect infestation, those kinds of things. But with the COVID-19, it's been controversial. Part of the public feels like we haven't done enough, and part feels like we've done too much. So the staff have had to endure that being stretched. And that's been a challenge. And, now that we're moving into the vaccination phase, it's even more challenging because there's a lot of demand for this vaccine and a limited supply. We're trying to stick with the 70 and older group until we have trouble filling those appointment slots. And then we're going to go to the 60 and older group, because the 60 and older represents right at 90% of our deaths and 75% of our hospitalizations. So we will get the biggest public health return by staying the course and getting through the 70 and older and then 60 and older, and then just moving on, kind of more general approach after that to try to get to a herd immunity. But we want to stick to our most vulnerable populations first. Let's see here. We got Roberts Pharmacy joining. I bet you that's our other member to make us a quorum. That's probably Laura Ann Roberts, I bet. Let's see. Roberts Pharmacy, is that okay? Can you unmute and just let me know for sure that it's Laura Ann Roberts?
I'm here. I can hear you.
All right, Jake, we do have a quorum. Layla, is Gail there?
Hello,
Gail is there. She's hanging up the phone. I tell you what, Jake, let's let Gail do a roll call and we'll confirm our quorum, and then we'll move from there. Oh, you're muted, Gail. I muted you while you were on the phone. I'm sorry.
Okay, I have Layla Haddix, Dr. Daly, Judge Craig, Jake Staten, Susan Cash, Judy Brown, and Laura Roberts.
And how many total is that?
7.
7. So that is a quorum. So Jake, you're the officer that's on. If you want to call us to order.
Did just one matter of business there, Layla. Did you name Dr. Daly? He's on here, isn't he?
Yes.
Okay. All right. Yeah, let's call a meeting to order then. And I guess I don't have agenda right here in front of me, but with Sean's help here, we'll get through this. The first, I guess, order of business would be to approve our minutes of our last meeting, I guess.
That's correct, sir. That is the first item. I'm going to go ahead and put them on the screen. Everyone had the packet sent to you in advance. So you should have had a chance to look at these. These are the minutes from our February 10th meeting of last year. And again, this was in the packet that was sent out to everyone. So we would need a motion to approve the minutes.
Sean, I will make the motion, Judge Craig.
All right. Who was it that
Layla
made?
seconded.
Layla seconded it. Okay. Jake, if we could see if anyone has any discussion about
Yes.
this.
Yes, that's what I was going to get to there. And Sean, you all, Gail did get me the packet, but like everyone else, I'm running here and there, and I had to run back in. I'm off at the courthouse today, and I ran back in here to get on the meeting and left the packet at my house. But I had looked through it a little bit there, and I appreciate Gail getting it to me. But yeah, if anyone has any comments or anything about the minutes before we approve them here, let them speak now. If no comments, then the minutes are approved then as they stand. Do we have any new business or anything that needs to be brought up? I got to say, we do miss our refreshments there. I told Gail she could bring me some up here if she wanted to. John, what would be next? I know we're going to get to our tax rate, but is that?
The health education report is next on the agenda, so I'll put that up on the screen, and we'll ask Tracy and Shannon there to present. And if Tracy or Shannon, if one of you all are talking, you're muted.
Okay, I'm unmuted, I think.
All right.
Okay. We have put together, of course, several data sheets, and those are also in the packet. And I won't go over these word for word because there's a lot of data there. But some things I just wanted you to be aware of. We get our data from county health rankings, and out of 120 counties for 2020 with our health outcomes, Clinton County ranked a 62. So that's actually, kind of in the middle. It's a good rating. Through the years, our rating has gotten better. In 2019, we were a 64. In 2015, we were a 99. And in 2011, we were a 93. So the lower the rating, the better the score. So our overall health is getting better in Clinton County. If you want to look at the second page of the data, and this just kind of breaks down our demographics and our health behaviors. And you can see some things have stayed the same on this data, and some things actually have gotten not the same, and the rates have changed and gotten a little worse. For example, adult smoking. We can see in 2015 that the baseline was at 26%. The latest data was at 25%. Then that was in Kentucky. And of course, for Clinton County in 2015, we were at 21%. And in 2020, the latest data is 23. So our rates have kind of went up a little bit. So that's just how, when you look at these sheets, you can tell, if the rates have went up, if they've went down, and of course, if they stayed the same with the equal sign. So it's kind of self-explanatory. And the same thing for the third sheet. This is our Socio-Economic Factors. And it just goes through different things, our children in poverty, children in single parent households, and so forth, grandparents raising children. Some things that Health Ed are doing, we do have our community health assessments completed, and these are located on our website. We are working on our individual county CHIPs, and that's our community health improvement plans. Those have gotten delayed due to COVID. Of course, the world kind of stopped with COVID when COVID hit. So, but we hopefully will start picking those back up and working on our plans soon. And some of the things with our community health assessments that we found to be our target areas when working with our coalition is for Clinton County, our top things were obesity. The second was substance use. And our third thing we wanted to work on is food insecurity. So we felt those were some of the biggest issues that are happening in Clinton County at this time. Other things we have going on, we're working with the ACEs, and that's the, I just went blank.
Adverse childhood experiences.
There you go. Yes. And we work with the Bounce Coalition with that. And also we have gotten, since we're not able to go into the schools, we have had our school programs professionally videoed and have those set up on a Google platform, Google Schools, the platform that they use. So the kids are still able to get that content, and we can still also serve our grants and be adequate that way. So that is all I have. Do you have anything you want to add, Tracy? Okay. Does anybody have any questions?
Very good job.
All right. Well, thank you, Jay. Thank you.
Jake, the next item on the agenda is the tax rate and the budget, so I'll move into that if it's your pleasure.
Yes, go ahead.
All right, so technically we approve the tax rate first, but always present the tax rate in perspective of the budget so that you'll have a perspective of what it is you're doing here. So I'm gonna put this on the screen, try to zoom in a little bit. All right, so I'm going to just go through the budget and discuss why I think your tax rate is sufficient where it is in perspective of the budget. At the very top of your budget in this top block, and thanks to Ron for putting this together for me, he does the bulk of this, and I present it. You can see this is our current year budget. This was what was approved last year, or our current year at last year's meeting, and the current year that we're operating under. But what we've changed is we checked the balances as of December 31st, and there's $243,348 left in your operating fund as of December 31, $103,946 in your capital fund, and for total $347,295. And then these expenditures down here have been adjusted some as things have been paid. It looks like most of those are still at zero. So, but we do anticipate spending the money on the items that you approve for the current year. So we are projecting to end the current year at $300,860 in our accounts in total. And we drop that amount down here into the estimated opening balance. Now, in all likelihood, you'll come out a little bit better than that. You'll see as I present the budget, we have several miscellaneous unknown expense categories. And when we don't spend all those, and we usually don't, they stay in your accounts. So you'll likely come in a little better than that. But for the moment, where we project beginning next year is $196,394 in the operating fund or the checking account, and $104,465 in the capital fund or what we have invested in CDs. And that totals the $300,860 we have as an estimated opening balance. Right now, your tax rate is 0.035 per $100, or another way of saying that is 3.5 cents per $100 of property value. And I'm going to present this middle column, assuming you're going to keep that tax rate. I'll be recommending you do that. There are a couple other columns for comparison, what we would call a break-even column, and one over here in case you wanted to have a surplus to be saving for some special project. It just gives you a little extra way to see the revenues in perspective. Of course, if you wanted to set some other tax rate besides what we have presented here, Ron can adjust those on the fly and tell you the differences immediately. So if you wanted to do something different, we could do that during the meeting on the fly. If you keep your tax rate at the 3.5 cents per $100 of property value, real property taxes would bring in $127,847. Now, the way we arrive at these amounts, you'll see that we have a calculation sheet where we break the taxing categories into real property, personal property, and motor vehicle. And then there's subcategories below that. And we get those subcategories from this sheet that's in your packet also, that's sent to us from the State Finance and Administration Cabinet. This is the same property value sheet that's forwarded to all the taxing districts, whether it's the school board or the county or library or whoever does taxes. But again, we take the appropriate category from this sheet. We put it on these calculation sheets. We add it up. We multiply it by whatever tax rate you've set. We multiply it by a 95% collection rate. And that's the figure that we move over to the tax estimate on the budget. So again, at the 3.5 cents of $100 per $100 of real property taxes, it's $127,847. Personal property would bring in $25,836. Motor vehicle would bring in $20,487.60. Some delinquent tax collections, $7,025. The telecommunications tax, $1,186. And then interest, $2,203.91. And you can see here in the footnote, our interest on our checking account is 0.6%, and on the CD, it's 1%. So that would be our interest. When you total up those revenues, the receipts total to $184,588. When you add that to the estimated opening balance, the funds that are available next year are $485,448. Now, what we're asking you to spend next year is in the categories that are below under budgeted expenditures. Every county in the district pays 2.8 cents per $100 of property value into the district budget. When I refer to the district budget, that's our operation budget. That's the big budget that the district board approves that pays for staff salaries and travel and building expenses and those kinds of things. So each county contributes toward our staff costs and, building costs, travel costs, phone costs, and so forth at this rate, 2.8 cents per $100 of property value. By the way, most of our cost as an organization is staff costs, somewhere between 75 and 80%. So that's $146,671. Under the category of building maintenance and repair, we have snow removal, $1,000. For the last several years, we haven't needed that, but this year we have. Fall and spring landscaping maintenance, $1,000, and miscellaneous unknown, $10,000. We put miscellaneous expenses in the budget because, sometimes things that we don't anticipate happen during the year, and we don't have those unexpected things line itemed in the budget. So, we want to be able to have a little bit of flexible money to take care of what pops up without having to call a board meeting because we don't have an line item. So if you total those up, the total building maintenance and repairs, $12,000. Under furniture and fixtures, and by the way, once I present this, if you want to ask Gail any questions about why she's asking for any of these things, you're welcome to do that. By the way, what I do each year is I send all of the staff an email telling them it's time to start planning for the board meeting. And if they have needs such as a new desk or a file cabinet or a chair, or if they need decorations or painting of their office or whatever, that it's time for them to present that to their office manager, Gail, in your situation. And if she agrees that that's a need, she'll do the research for the budgeted costs and put them in this budget request. So what's under the category of furniture and fixtures? New floor rugs for the entryways for the clinic and environmental, $2,000. a TV for the conference room, $1,000, a literature organizer for the forums, $1,000, and miscellaneous unknown, $5,000, totaled up to $9,000. Under the category of equipment, maintaining our generator, $500. Miscellaneous computer and related equipment, $9,200. That would be for any failure of equipment at all, whether it's monitors or hard drives or keyboards or servers or routers or whatever might happen in the computer area. Again, that's a category, we very rarely spend everything we budget there, but we have that there in case those kinds of things fell on us. And then just the general equipment miscellaneous, $5,000, totals up $14,700. The other expenses, publishing our financial statements on the state's website and in the newspaper, $1,400. Paying the board's expenses to Cowboy and KPHA, $1,000. And assuming we get to have a board meeting in person next year, $500 for meeting expenses. That totals up to all expenditures, $185,571. Now, when you subtract that from the funds that we had available, it's $299,877 balance remaining, which is a $982 deficit, which is close enough that you don't really worry about it. But just in case you are concerned, I'll show you on into your packet here. This is where you've actually closed each year for the past several years. And you can see at your tax rate where it is, you've closed out fine. So, and that's because we don't always spend all those miscellaneous unknown categories. So my point is your tax rate is sufficient where it is. So with that, Jake, I will turn it over to you for a discussion about the tax rate, or if anyone has any questions for me or Gail about anything that's in the budget, or Ron, feel free to ask.
Hey, Sean,
Yes.
there was one item, and you may have said it, but I didn't think you did. If you guys will notice on that, or would have noticed on the budget, there was a line item for an audit next year. You guys are due for your audit. You only get one every 4 years. So you are due for your audit next year. So that's why we budgeted $1,400. It will be paid in next fiscal year, but it'll be an audit of the current year we're in's books. So that's why it says fiscal year 2021, but you'll actually be paying it next year, which is why we got it in the budget.
Thank you, Ron. I got out of line there, didn't I? So the audit is $1,400, and the advertising in the newspaper and on the state website's $300. And then I think I got the rest right. Dues and subscriptions, $1,000, and a board meeting, $500. So thank you, Ron, for catching that.
All right. Do we have any one that has a question or any comments about the budget?
Jake, I'll make one caveat. Assuming that you all are going to be interested in keeping the tax rate the same, there was a state law that was just passed that it appears that the health departments are going to be subject to the compensating tax rate, but the Cabinet for Health and Families, of which the Department for Public Health is in, has taken the position that doesn't apply to us. And that's what we're going to go by, since they're the ones that set our administrative regulations or the rules that we follow. They're the ones that define the laws for us. But the Department of Local Government has taken the position they think it does apply to us. So my point is, attorneys for those two different departments, cabinets, are trying to sort that out. So what I would recommend, if you're going to want to leave the tax rate the same, just make the motion, that you want to leave the tax rate at 3.5 cents per $100 of property value across the board, or accept the compensating tax rate. The compensating tax rate means that you set your tax rate at the amount that keeps the revenue the same. So really, we're either proposing to keep the tax rate the same or the revenue the same, depending on which one of those laws apply to us, if that makes sense.
Yes. Well, we'll
Sean,
stand
I'll
with you.
make a
We'll
motion
stand
to
with you
keep
on your
the tax
position.
rate the same.
That was Judge Craig, I think, Jake. What did you say, Judge Craig?
I make a motion that we keep the tax rates the same.
Or accept the compensating tax rate if that's what applies?
When a determination, Judge, has been made, is what Sean, I think, is saying, we may have to go with the compensation rate. The lawyers are trying to figure that out right now. So is that your motion, that it stay the same? And then if it has to go with the compensating rate, it goes with it?
Judge,
I don't know.
if you're talking, I can't hear you. I see you're unmuted, but I still don't hear you.
Okay.
Oh, yeah, I
So-
hear you now.
Oh, okay. So we could go either way with that?
Yeah, it just depends on which one of the laws applies to us, Judge. We would either stay at the 3.5 cents if that law applies to us, or we would take the compensating rate if that law ends up applying to us. So that
Okay,
would be the motion we
Is
would make.
that your motion then, Judge Craig?
Yes, that's my motion.
Yeah, I hear a second.
Dr. Daly, you're muted if you're, I see you talking, but I don't hear you.
This is Carol Denny. Can you hear me?
I hear you.
Okay, I'll second it if nobody else has.
All right, Carol Denny has joined the meeting now.
So we have a second, so all in favor? Yay.
And if you're opposed, please shake your head or put it in the chat box so we will know.
Shake it no, or put it in the chat box.
If you're
Sounds
having
like sounds like the motion is passed.
All right, thank you. It looked like it was unanimous. All right, then the next one, Jake, would be to approve the budget. So I would recommend the board approve it as presented.
Do I hear a motion to approve the budget as presented?
I'll make the motion.
I'll second.
All right, who made the motion? I didn't catch that. Was that?
Judy Brown.
All right, and Jake made the second? I just want to make
Yes.
sure Gail gets it in the minutes correctly.
I
Yes.
got it.
All right, Jake, you got the motion in second. If you want to have discussion and a vote.
Yeah, do we have any more discussion about either item, the budget or the tax? No one? We had the vote already then on the budget, or have we?
No, we haven't. We
Okay.
voted on the tax rate.
All right, everyone in favor of the budget as it is presented here today, shake your head yes, or speak if we can hear you, and say yes, you approve it.
Yes.
Yes,
Yes.
sounds like it's unanimous.
All right. Jake, by the way, Carol Denny has arrived and she outranks you. She's the
Oh,
vice
no,
chair.
that's okay.
I knew she's got a lot more power than I do. I know that.
So it sounded like she's leaving you in charge of running the meeting.
Go right ahead, yeah.
We're about to the adjourn part, Carol.
Well, I'm sorry. I couldn't get away from everybody. You know how that.
We all understand that.
The next item, Jake, is the members whose terms expire. And Gail has that listed on the agenda. Let's see, it's,
How are we gonna go about getting the sheets to get them signed, I guess? would be the
Well,
question.
we won't be getting sheets this year. The state's transitioning from paper to entering it to a state website dashboard.
Okay,
So unless someone doesn't want to serve again, we will go ahead and enter your names into that dashboard. And so, sometime between, I'll probably ask the office managers to do that in March or April. So if there's anyone that doesn't want to serve, just let us know, me or Gail, before then. and we'll work out something else, or we'll work toward another solution. But for now, the assumption is everyone's willing to continue to serve. Of course, your terms are good till the end of this calendar year, till the end of 21, but this would be for 22, 23. So there's no action on that. Just let people know if they're tired of serving or feel like they've done their part, to just let us know.
Okay, can we hear the names so we'll know who's
Yes, it's
expired?
Dr. Powell, Michael Wilson, Carol Denny, Susan Cash, Laura Roberts, and Christy Guffey.
I've already sent my papers back in. Somebody mailed me some and I filled them out and sent them back in.
Well, that's because Gail was more efficient than me, and she got it done before I told her they wasn't doing the papers this year.
Oh, okay.
So that's good. We'll use the papers. We can enter the data off the paper, so it's not wasted. She
Use
just
that
wants-
as evidence that I said I would, huh?
That's right. That's right.
We can't get rid of our vice chair.
Oh, you're doing a fine job.
All right, Jake, the next item on the agenda is the officers, and we've already talked about that. The chair is Dr. Powell. The vice chair is Carol Denny. Let me unfilter my file here. And the treasurer is yourself, Jake Staten, and I serve as a non-voting member of the board as the secretary. It's good that I serve in that capacity because I can represent your board at state meetings and things if there's not a board member present. But that's your officers at present. The chair is Dr. Powell. The vice chair is Carol Denny, treasurer Jake Staten, and then me as the non-voting member's secretary.
We probably have Judy or someone wanting to be the treasurer, so.
That's okay. I'll let you keep it. You're doing a good job.
Yeah.
I sure ain't gonna switch places with you.
So do we need a motion to accept the members as they are? Do we do that each year, Sean?
Yeah, you elect. So if you want to keep the same slate of officers, someone could make a motion just to leave all the officers the same.
Do I hear a motion?
I'll make the motion.
That was Judy Brown.
Layla second.
Layla seconded.
Any discussion? We'll take a vote on that then to leave the board members the same. And just shake your head, yes. I don't know that everybody has audio.
Yes,
Or
I'll say yes. I don't.
speak up, I guess.
Yes.
Yes. Looks like the motion carries. Board members will stay the same. And
The next item, Jake, is the members who serve on the district board. The judge is automatically on the district board along with one additional member. The number of members you get on the district board is based on your county's population size. So for every 15,000 or a piece of 15,000, you get an extra member. Of course, your all are population's less than 15,000, so you get one additional member, and presently that's Jake.
now who all wants that job?
No, I make a
give it up.
motion, we just leave it as it is.
Second it.
Motion's been made to leave me on there, so we'll take a vote on it.
Yes.
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 Thank you all. Thank you all.
You're welcome.
All right, Jake, and the last item on the agenda before adjourning is my comments. And I went ahead and made most of my comments before we called the meeting to order out of interest of time. But I was just talking about, the challenges of COVID and how it's not been without controversy. Some of the public feels like early on in the enforcement phase that we were not doing enough, or some felt we were doing too much. And now that we're in the vaccine phase, there's a lot more demand than there is supply. And, a lot of folks feel like they know a way to do it better. But, we're focusing right now on the 70 and older. And after that, we're going to focus on the 60 and older. At 60 and older, you're getting about 90% of our deaths, and you're getting about 75% of our hospitalizations. So that's definitely where we're going to get our biggest return. And, I hope that there isn't, special interests that get involved and decisions get made based on something other than public health. I want everyone that wants the vaccine to have it. I mean, we need to get a herd immunity. But as we're approaching that herd immunity, we want to take care of our most vulnerable population first. With the amount of vaccine that's coming into our district now, we should be able to get through the 60 and older group, I'm going to say roughly 8 weeks. And then it'll just open up to, a lot more people. Of course, when it opens up to a lot more people, there's going to be way, way more demand than there is supply. And it'll take us a while to get through the rest of the 1C group. Several weeks to months to get through that group. But right now, our health department is the only organization in our 10 counties that's getting a flexible supply of vaccine. What I mean is that they ship all of our doses to Somerset, and we divide it from there and send it out to the counties. So each week we look at the supply of vaccine that's coming into all the area providers. And we try to direct our vaccine to the places that have the least resources to try to balance things out across the counties as fairly as we can. And that's a very fluid situation. The governor announces new partners every Thursday. And, so as we see the situation change, we will evolve with it. And we will always try to make sure that we're pushing our supply to the counties that have the least resources. So right now, we're getting close to 5,000, or we will be within the next couple of weeks, about 5,000 doses a week into our district. So it's looking better.
Is the governor opening it up on March the 1st for the ones over 60? That's what I saw posted on something yesterday.
What he said was, and I listened to his presentation. What he said was that the regional hubs would open up to 1C March 1st. And he said with a focus on the 60 and older, and that everyone else will stay a little more precise until they get through that 70 and older group, and then they'll go to the 60 and older. So it's not like it's going to open up to everyone in the 1C group. There's probably in our state 1 to 2 million people in that group.
Right.
And we before we start, as I said earlier, 60 and older represents about 90% of our deaths. So I don't want people that's in the 10% likelihood to die to be able to push ahead of people that's in the 90% likelihood to die. So we're going to stick with the 60 and older until we, when we have trouble filling those appointment slots, then we'll just go ahead and open it up broader. But we will have made the biggest public health difference. And you got to think, we had our first case in Kentucky in March, and in under a year we have a vaccine, 2 vaccines, almost 3 approved. We've already vaccinated when I say we, I mean everyone that's involved with this, not just the health department, but the nursing homes, working on the personal care homes, got the school staff, first responders, health staff, and we're probably right now about halfway through the 70 and older. And over the next, like I said, 6 to 8 weeks, we'll get through the 60 and older. So, by the time we get to about a year into it, we will have the most vulnerable people in Kentucky protected with a vaccine. So it's really moved pretty fast, even though it doesn't feel like it has. And I know this year has been a lot of pain on a lot of people. There's no doubt. There's been pains for businesses, pains for families, pain for school, been all the death and hospitalizations. It's been a tremendously difficult year on a lot of fronts. But anyway, anyone that wants to ask me any question about any other health department related thing or the COVID response, feel free.
I just wanted to say, I'm sure everybody's aware that the hospital's going to be getting more vaccines too. So, that's another option. If anybody has problems getting them at the health department or anything, they're supposed to be getting 500 vaccines a week is what they're telling us.
Yeah, and if you will, on our website every single day, if you go to our homepage and click that COVID-19 banner, we
Yeah.
update all the providers and their contact information and websites, just however you set up appointment, we update that every day.
Yeah.
So anybody in our district that wants to know an area provider can go to our website and get that information.
Yeah.
Is the hospital doing the same thing? Are they still on the 70 and older?
Right
They are-
now, yeah.
Yeah.
Well, as far as I know.
Yeah,
Okay.
for the moment,
Okay.
I expect they are. Now,
Okay.
what the governor says is if you have trouble filling your appointments, like let's say, you've got 3 or 4 slots left and you're having trouble finding people to fill that, go ahead and put, 3 60-year-olds in there so you use everything. But no one right now should be opened up aggressively into the 1C category until we get through the 1B. I mean, we are allowed to drop into the 1C if we have trouble filling appointments. And when it gets really, really difficult to fill those appointments, we'll just open up to the 60 and older. We have permission to do that whenever we feel like we've gotten through the 70 and older. So it's just a matter of time.
Any
Any
other
other-
discussion?
I have
Anyone
been
have any
having
comments?
I've been having people ask me how to go about doing this. Are they calling and making appointments to get the injections? I mean, the vaccinations, or how are they doing that, Sean?
Every provider is different, so you'll have to look at our website. For us at the health department, since we're in the 70 and year olds, we're taking phone calls. Now, we had complaints that our phone lines was busy all day. Even though we had 30 phone lines and 20 operators, people were having to call back many, many times. Tomorrow, I'm having a meeting with an outside vendor that will, they're able to take tens of thousands of calls a minute. And we won't have that, assuming that the price is right and we can work with them, we won't have that problem going forward. So we're going to sort through that. So for us, it's call in, and we'll post as soon as we're ready to take more appointments. We'll post it on our website and we'll post it on social media.
Okay.
Ours is a little bit more difficult because, as I said, we shift our supply to the counties that have the least resources. So we never know from week to week exactly where we're going to be pushing the, more or less of the vaccine. So, we kind of have to take it on a week by week basis. Whereas everyone else has a steady supply, that they're going to get week by week. Any other questions? There's
No
nothing
other
else but to
questions?
adjourn, Jake.
No other questions, then we move for a motion to adjourn. I'll make the motion to adjourn.
Layla seconded.
All in favor? Shake that head.
Aye.
Thank you all.
Thank
See
you
you
all
at the
very
next
much.
one.
All right.
you all.
Thank
Bye-bye.
you.